If we're learning something from our professors for our dental schools, it's our duty to give back to the community, to the people who do not have access to care and they need dental professionals like us.
So the CBCE course is designed to be an extension of dental school, learning how to work with different staff members, learning how to work with preceptors in different locations, and really understand the priority that public health and community health should be in every dentist profession. The different populations that students provide care for may not be like themselves, and that's part of the whole experience.
In dental school, it's mostly like ideal case scenarios that we deal with in school because we do have our professors. But when we come to these outreach clinics, we're actually thinking outside the box. We're dealing with the population that cannot afford implants or bridges or some other extensive dental work. So it's more like you're doing something for them to at least they can smile with confidence or they can eat.
My role at Cherry Health is as a general dentist. I rotated here as a D4 student at the University of Michigan. For me, that was integral in choosing the University of Michigan. I knew I wanted to be a public health dentist, and once I rotated and met all of my colleagues, I knew that this was the place I wanted to be.
Being a preceptor is probably one of the highlights of working at Cherry Health because we're able to give students an opportunity to not be in a clinical school setting, but they have the opportunity to do procedures as they would if they're in private practice, and they're able to go from room to room so that they have that more out of school private practice experience of what being a general dentist will look like.
I think these outreach experiences equips us to bring together our classroom knowledge and the clinical knowledge taught by our professors in the clinic, but at the same time preparing us to make informed decisions about our treatment plan, patient communication, and also dealing with the diverse patient populations.
A special thing about Cherry Health is the collaboration we have amongst our dentists. If someone had a question about how to do a procedure that maybe another dentist was really good at, we could ask and be mentored. I've found that as a new dentist, I still have that collaboration, and I have people who are willing to walk me through how to do new types of extractions or different types of surgeries.
The outreach experience has definitely made an impact on what I want to do after my graduation, because I was able to do different procedures from different specialties here. So I was able to know which patient population I look forward to working with. So I think this outreach experience really helps in deciding that way, what do you want to do after your graduation.
For me, working at Cherry Health means serving my community in Grand Rapids. It means that I get to use the skills that I worked on for so long as a student to help others. Working here means that I get to be mentored by people who care about other people and serving them. And working at Cherry Health means that I get to be fulfilled every day in my work.